In 1929, we see some developments in kind of more on the private side towards developing more insurance for people, largely tied to employment. So in 1929, Baylor University Hospital ends up signing this sort of contract with a group of teachers who are living in Texas at the time, and they are struggling to actually pay for hospital care, and so they've kind of negotiated this thing where, okay, well, we'll pay so much per semester, and this will cover, up to this many days in the hospital. The hospitals like this because people are having trouble paying for care, which means there's fewer patients, less income for hospitals. Patients like it because it enables them to actually go to these new emerging pinnacles of American medicine, where all this new technology is starting to change the reputation of hospitals for patients. That ends up developing into Blue Cross, which of course then evolves into Blue Cross Blue Shield. So we see that sort of thread connecting employment and healthcare start to emerge then, where groups of employees end up making these sorts of arrangements with hospitals. Blue Cross was specifically for hospital care, in order to help cover the costs of receiving that care. Now, it's important to note that this excludes medical care. So Blue Shield ends up emerging later to cover medical care. This is really focused on hospital expenses. And this model ends up spreading really quite rapidly throughout the United States as an effective model for hospital care. As this Blue Cross and Blue Shield model is expanding, you have people subscribing by the millions. It just skyrockets over the 1930s, 40s, 50s. More commercial insurers start entering the market, but a lot of them start cherry picking their subscribers. And so as they're pulling away perhaps the healthier groups of subscribers and offering them lower rates, these Blue Cross models are left with a more expensive population, and so they start having to change that community-based model into something that would be more competitive within that marketplace. In 1943, there's a War Labor Board decision which basically excludes benefits from these very strict wage increase controls they had enacted during the war. In other words, they said, okay, if companies want to offer benefits like health insurance to their employees, that's fine. We're not going to restrict any sort of changes in that, even though we have these controls on wages. So that suddenly became a way for industry to actually become more competitive in a marketplace. So if they wanted to preserve a group of workers, or if they wanted to attract workers to their company, they could offer more generous benefits, such as health insurance, to help attract and preserve the workforce that they were looking for. In the early 1950s, of course, there is also another decision by President Eisenhower, which actually excludes contributions to these group insurance plans from taxes. So that again helps to solidify this sort of link and the benefits that people are perceiving to be associated with getting healthcare coverage through their employment.